So my name's Katie Kirschner. I was born and raised in Fort McMurray, so I guess I've been here all my life. I left for a couple years just to do my schooling, and then there's no place like home, so I came back and have been enjoying being back in my community. My role at the hospital is that I'm a registered nurse in the ICU. Hey, welcome to the ICU. I'm gonna just get you hooked up to our monitor, okay? It's perfect. So there's really no typical day in the ICU. It really just depends on the patients that we have and what illnesses they have and how critically ill they are. So usually we work a 7 to 7 shift. So we come in, get report, and then you kind of try to figure out what's going on with your patient. How are you feeling?
Sore.
Yeah? Having any chest pain right now?
A little.
Is it going to your arm at all, or is it just staying right in your chest?
Just staying in your chest.
Yeah? I think it was kind of ingrained in me from a young age to go into a helping profession. My brother is a doctor and 2 of my sisters are nurses, so it was kind of just the healthcare field has kind of just been, I think, in my blood. All right, and now, do you think you'd be okay to sit up and I'll just listen to your lungs? All right, just take some deep breaths for me. Perfect. There's so many different touchy moments that have happened. I know some of the most memorable ones for me are the ones where you're dealing with a very ill patient, and say usually if people come to ICU, they're not usually responding or able to speak for themselves, whether they're unresponsive or intubated or something like that. And I think just you're caring for them physically, but then caring for the family emotionally and kind of helping them on that journey through whatever's going on, keeping them informed. Also, it's tough when it comes to some patients, unfortunately, it's end-of-life care. So we have to always be talking with the families and be a part of that emotional journey that they're going through, and especially if it comes that the patient deteriorates so much that we can't get them back. I think it's a real honor and a privilege to be a part of that with the family, that they allow you in to actually be that emotional support, and especially be a part of those moments where if I wasn't in this field, I'd never get to experience with them. You form a real bond with the families, and I think those are the moments that I'll cherish the most.
Going behind the scenes and removing the mask on our healthcare experts, for Go, I'm Jordan Hurtner.